Hi, everybody. Welcome to my fake podcast where I interview my fellow coworkers to find out the answers to life's greatest questions. Well, maybe not the greatest questions, but definitely to get some clarity around the financial questions that people, especially around retirement age, have. So today, my guest is Roger Luchene. Welcome, Roger. I'm super
Thank you,
excited to have you on my
Colleen.
fake podcast.
Thank you, Colleen. Thanks for having me. So my name is Roger, like Colleen said, Roger Luchene. I've been with Hammer Financial Group for about 10 years now, and my specialty is Medicare. I'm the Medicare, I guess you could call guru in our office. And so today, Colleen and I are going to have a conversation about how to sign up for Medicare.
Okay, so I'll be honest. And before I started working here, I knew absolutely nothing about what happens after you retire. I'm in that phase of life where all you just told to save, 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 save. So been very enlightening to come here and have the questions to start thinking about retirement and what you need to do. And Medicare is so much more complicated than I thought it was. I thought it was just you turn 65, the government flips a switch, and you're all good. So I'm kind of learning that it's not necessarily that easy, but I know that you can walk me through it.
Yeah, I'll be happy to.
So I guess my first question would be the government doesn't turn on a switch. So I need to go apply. How do I do that?
So there's a couple things, a couple ways you can sign up for social or Medicare. And just to clear up something, when you sign up for Medicare, you actually have to do that through Social Security. A lot of people think it's a separate entity, and they are, but Medicare uses Social Security as their vehicle to sign up. So as far as signing up for Medicare, if you're going to be collecting Social Security, typically Medicare will send you a card, your Medicare card, 3 months prior to your 65th birthday. If you're not going to be collecting Social Security, you've decided to delay your Social Security to let it grow so that you have more money in retirement, then you intend to go on Medicare, then you actually have to do something. You have to engage with the Social Security office. And there's a couple ways you can do that. First one is you can go to ssa.gov and set up a portal. A lot of people have already done that. You can go in there to see your Social Security statements, make sure they're correct. But that's also a vehicle, easiest probably way to go ahead and sign up for Medicare. There's a tab in there signing up for Medicare, and that's probably the simplest way. The other way is you can actually go to a Social Security office, but in the last, especially since the pandemic, it's really, really difficult to get appointments at the Social Security office. They're literally 2 to 3 months out in some cases. So, and then the third way is you can call Social Security office, but that has the same pitfalls. A lot of times you can call and you're calling to set up a call for 2 or 3 months into the future. So we recommend that people go to ssa.gov, set up a portal, and that's by far the easiest way to get to sign up for Medicare Part A and Part B.
Okay, but regardless, there's probably going to be a little bit of a wait.
There is going to be a little bit of a wait. Now, they will not let you do it any sooner than 90 days prior to your 65th birthday. But after, as long as you're within that 90 days, you absolutely can sign up.
Okay, so is that the only time I can apply? When can I apply? Do I have to do it right when I turn 65? Can I do it after I turn 65?
So it depends. So if you are covered what's considered creditable coverage through either your employer or your spouse's employer, and you intend to work or your spouse intends to work and you still have coverage, then you don't have to do anything. If you're collecting Social Security and you're in that situation where you're covered under a group health plan, again, through your work or through your spouse's employer, then you can delay your Part B because there's a premium for Part B. So that's a little bit of a tricky answer there. But in general, you can sign up for Medicare 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday to avoid penalties. But I would just want to be clear on that. If you have creditable coverage, then there is no penalty to wait down the road. And then that kind of kicks in and let me go back real quick. If you do sign up within those periods, it always takes effect the month of your 65th birthday. The first of the month of your 65th birthday is when your Medicare would begin. So even if you let's just say you turn 65 on May 30th, you're eligible for Medicare on May 1st. Now, there's one exception to that. If your birthday is the first of the month, you're actually eligible for Medicare the first of the prior month. So again, let's say your birthday is May 1st, you would be eligible for Medicare April 1st. And then there is what they call special enrollment periods, or SEPs. The government loves acronyms. So SEP is for special enrollment period. And those typically happen if you're going to be signing up past your 65th birthday. You've decided to work till 67 or 68 or 69. And that triggers what they call a special enrollment period. And typically those are going to last 63 days after your group coverage ends. Now, we don't recommend that you wait those 63 days. We recommend that you get the process in place so that when your group coverage ends one day, your Medicare starts the following day. But those are generally your Medicare enrollment periods, your initial enrollment period, and then your special enrollment periods if you fall into one of those categories.
Okay, so you alluded to Part A and Part B. So do you have to sign up for Part A? I know you said you don't have to sign up for Part B if you have credible coverage.
Yeah, so you don't have, I'm sorry. So you don't have to sign up for Part A. We recommend it that you sign up for Part A because number one, it's free. There's no cost to it. And it could possibly supplement your group health coverage that you currently have if you should have a hospital stay. There's one exception to that. If you are contributing to an HSA, a health savings account, you should not sign up for Part A or Part B because there's a crazy rule with Medicare that says if you sign up for A or B and you're contributing to an HSA, those contributions become taxable, which completely defeats the purpose of signing up or having an HSA. So if you're contributing to an HSA, we recommend that you do not sign up for A or B, provided you have creditable coverage.
Okay, gotcha. So then my next question is, what if I am a gambler and I want to roll those dice and I don't want to sign up? Do I have to sign up?
So you do not have to sign up, but just like everything with the government, if you don't do something that they recommend, there's going to be a penalty. And so there's no penalty for Part A, but there is a Part B penalty. So for every 12-month period that you do not have Part B and you do not have creditable coverage, you're going to pay a 10% penalty. And the 10% is of the Part B premium. This year, that premium is $164.90 a month. So let's say that you just for whatever reason didn't sign up for Medicare and you did not have creditable coverage and you went a year, you're going to have a roughly $16 penalty every month for the rest of your life. And if it's longer than 1 year, then obviously that penalty is going to get bigger. And there's also a penalty for Part D, your prescription drug coverage. If you don't have creditable prescription drug coverage and you don't sign up for Medicare when you're eligible, then there is a 1% per month penalty for every month that you did not have coverage. And again, not want to get into too many specifics today and don't want to make it too confusing, but let's say you went 10 months without prescription drug coverage and then all of a sudden you signed up for one and you did not have creditable coverage, you're going to have a 10% penalty. And what they do is they take the national average drug plan in the United States, and this year it's around $32, and I think it's $32.74. So let's say you went 10 months, you would literally have a $3.27 penalty every month for the rest of your life. So once you incur a penalty with Medicare, it never goes away. So we always recommend that when you're first eligible, you do sign up for Part A and Part B, and then a prescription drug plan or a Medicare Advantage plan. And again, those are all things that we would help you with. But just understand that there could potentially be some penalties if you don't have creditable coverage.
Got it. All right. So now let's say, regardless of the circumstances, whether I'm 68, whether I have credible, whatever, I've gotten to the point where I am ready for Medicare. What do I do?
Yeah, so the first thing is obviously, like we talked about, get signed up for Part A and Part B. And then after that, a lot of people don't realize that there's some gaps in Medicare. There's some things that they don't cover. There's deductibles, there's copays, there's co-insurances, depending on whether it's a Part A or a Part B claim. And we can go into all of that if somebody wants to give us a call and talk about their specific situations. But if you once you've signed up for Part A and Part B, again, that's where we come involved and we help you with those gaps. We can help you with whether it's a Medicare supplement, a Medicare Advantage plan, a prescription drug plan, whatever's right for your particular situation. And in our office, we actually do all of those. So we're a broker. here. We represent a lot of companies. We do prescription drug plans, we do Medicare supplements, and we do Medicare Advantage plans. And we help everybody with all those just to make sure that they have the right coverage for their particular situation. Because a lot of people will come in and see me and they'll say, oh, my brother has this is what I want. But their brother's situation, or aunt or uncle or neighbor or cousin, is going to be completely different from them. So we want to do an analysis of your particular situation so that you make sure you pick the right plan that's best for you. And there's a lot of options out there. There's a lot of confusion with all the TV commercials and all the stuff that people get in the mail around their 65th birthday, and they get very confusing. And that's kind of where we come involved. We're the experts in that. And we want to help you navigate all of your options to make sure that you get the best plan possible for you.
Okay, so if I understand this right, you have software where you can kind of compare different plans and it will help calculate what makes the most sense.
That's correct. So what we do is when somebody would come in and meet with one of our advisors, we would require that they bring in their prescription drugs, if they have any medical histories, if they have a particular doctor that they want to see, all of that stuff that revolves around making those decisions. You're exactly right. We have a program that we plug everything into, and it's going to spit out all of the plans that are available in our area. We may or may not offer all of those plans, but if we don't offer the plan, we'll also still go over that with you and explain to you how to sign up for it. But in most cases, we offer most of the plans in our area. And so we're just going to give you some recommendations and kind of walk you through that process and kind of more or less educate you, Colleen, just to make sure that you're making a very educated decision, because it is important. And you can cost yourself thousands of dollars by making the wrong decision over your lifetime, or even in a single year if you pick the wrong prescription drug plan. So we're very adept at making sure that we help our clients pick the exact coverage for them. We're not going to make the decisions for them. We're going to educate them. That's our job. And then just make sure that we follow up with them each year to make sure that those plans still fit their needs and see if there's something better. We're going to do yearly reviews with them. So it's all about making sure that our clients have the exact coverage that meets their needs to the best of our ability, because everybody's situation is different.
For sure, for sure. Okay, so now let's say somebody out there is watching this and they're ready to go and they want your help. What should they do?
So we always recommend plan earlier rather than later. I've had clients come in and say, I need something effective tomorrow, and that's not always the best situation. So what we recommend is 6 months ahead of time. If you're thinking about retirement, even if you're on the fence and you're not sure, our consultations are always no charge. So doesn't cost anything to come in and see us. We recommend get educated early. And then, so I like the 6-month mark if you're thinking about retiring, and then probably 3 months prior to when you're going to retire, we would do just a review of what our recommendations were going to be, make sure they still fit your needs, make sure you don't have any questions. And then ultimately, we would want to do applications at least a month ahead of time prior to when you're going to be on Medicare, just to make sure everything is in place, all the bugaboos been worked out, you understand what plans you have, and in case you have any questions or you need any further guidance, we can do that. But at that point, we would do applications and then again walk you through the whole process. When you walk out of our office, you're going to have copies of your applications, you're going to have your to-do list, and then we're going to check in with you periodically just to make sure everything is working out well for you.
Got it. So when they're ready to go, they should call Hammer Financial Group at 219-864-8266. And it's not just Roger Luchene, right? There's a whole Medicare team if your calendar's booked.
Correct, we do. We have three agents in our office. We're working on a fourth one, but we have 3 very capable agents in our office. And probably more importantly, we have kind of our gatekeeper, Kimberly, who is our assistant, who pretty much handles all of the paperwork, and she makes sure that we're all on task and make sure that our calendars are nice and full and make sure that everything's run smoothly so that when you come in, you're getting our full attention. So we generally schedule an hour and a half. Most appointments don't take that long, but we want to make sure that everybody has ample time to get all of their questions answered so that they walk out comfortable with what we've told them.
Gotcha. Well, this has been enlightening. Thank you so much for taking the time to explain everything today.
Well, thank you for your time, Colleen. I appreciate you very much. And hopefully we'll see all of you soon.
Yeah, absolutely. Thanks again. We'll talk to you soon on the next episode of my fake podcast.
Yeah, thank you.
Thanks.